If you failed the MCCQE1 exam, I need you to stop. Just stop. Don't study harder. Rather, you have to understand something. Your score isn't a verdict. It's a diagnostic report that the medical council is giving you. And if you ignore what it is telling you, you don't get unlimited attempts. Remember, you can have only 4 attempts. So now listen carefully. This video is for 2 doctors, 2 groups of people. Number 1 is the person who just failed the exam. The person feels very embarrassed. You feel shaken. Maybe you are even doubting yourself. And the other person is the one who has not written the exam yet, but assumes that failure only happens to other candidates. Both of you need strategy, because this exam does not reward effort only. It rewards alignment. So let's get something straight. Failing this exam does not mean you are not intelligent. It does not mean you don't belong to Canada, and it does not mean you can't be an excellent physician. But it usually means one of 3 things got broken. The first is your content coverage. The second is your clinical reasoning probably was affected. Or number 3, your execution under pressure. And if you haven't written the exam yet, those same 3 things will determine whether you pass the exam or not. So I need us to take time and build upon this very well. The phase 1 is what I call the diagnostic rebuild. If you failed the exam, the first thing you need to do is to open your supplemental information report. Open it not emotionally, but open it with strategy. Look at the discipline breakdown, because the Medical Council of Canada will provide that to you. Were you weak in psychiatry? Were you weak in ethics? Were you weak in preventative care? Were you weak in obstetrics? What about chronic disease management? Do not restart everything. No, that's the biggest mistake many candidates make. What you need to do is you rebuild where your weakness was. So go back to the core Canadian management principles. What is the first line therapy? What is the second line therapy? When do you refer a patient? What are the contraindications to the unique medications you need to learn based on the MCC objectives? What is the screening interval when it comes to preventative care? Not obscure trivia, just focus on the management decisions you need to know. Now, if you've not written the exam yet, this part is for your prevention. Before you go deep into question banks, you need to ask yourself honestly, can I confidently answer questions like, what is the next best step? What is the most appropriate management step? What screening should be done for a patient? And if for any reason you hesitate, then you are not ready for heavy question volume. You need structured alignment first before you proceed. The second phase I want you to focus on is the decision training. This is where most people sabotage themselves. You must shift from learning to deciding. What do I mean by this? Every day you need to do timed blocks. For example, 40 to 60 questions. Don't do it in tutor mode. Rather, do it timed, because the exam is a timed exam. And after each block, the exam is a timed exam. And after each block, review your wrong answers and categorize them. Was it a knowledge gap that I missed so far as that particular question was concerned? Did you misread the stem? Did you overthink the answer? Did you change a correct answer? You need to start tracking the patterns you exhibit when you are trying these paid questions by the Medical Council, or whether you are doing a question bank. And if you constantly choose answers that are technically true, but not the next best step, that is not a knowledge issue, because it looks like you know what to do for a patient in real life, but you have a reasoning issue. And reasoning improves under repetition with time pressure. If you haven't written the exam yet, this is your insurance policy. You cannot simulate calm on the exam day. Rather, what you have to do is to train for calm. And let's talk about the third phase. This is what I call stamina engineering, where you build stamina. Let me say something that most people ignore. The MCCQE1 is not just an intellectual exam. It's also an exam of cognitive endurance. You must do full-length simulations during your practice. You need to sit for long blocks. No phone, no pausing, no artificial comfort. Train your mind to think clearly in 6 hours, okay? And you need to understand that most second-time failures are not because someone forgot medicine, but it's because they were emotionally exhausted. You know, can you imagine thinking on your feet for 6 hours? It's not easy, right? So your brain must be conditioned to stay sharp, and this is not an optional thing. And the phase 4 is the performance protocol. The last 7 to 10 days before your exam, this is where people destroy months of preparation. This is not a time for you to get new resources. No, this is not a time for sudden strategy changes. Rather, what you need to do is to move into the consolidation mode. This is where you need to review algorithms. You need to review emergency management. You need to review screening timelines. You need to review ethics frameworks. You need to review chronic disease protocols. And around this time, sleep becomes non-negotiable. Hydration really matters, and light exercise also helps. The week before the exam is not about cramming information. No. It's about protecting the performance you've built over the period. So now let's talk about mindset. If you failed the exam, you now have something powerful. And what is that? Data. You have the data of the exam. You have the data of your performance. The medical council would have given you a supplementary exam report. And the data you have makes you very dangerous if you use it right. If you haven't failed, respect the exam right now, so you don't have to recover later. Because this exam is not trying to humiliate you. It is rather testing whether you can make safe decisions under pressure. So your future patients will not care how many attempts it actually took. They will care whether you can stabilize them, whether you can prioritize their care, and whether you can decide correctly. And that part is trainable. So whether you are rebuilding or you are trying to prevent failure, please remember that you need to build a system. Train decision making, engineer your stamina, protect your performance, and approach this exam like a clinician, not like a medical student. And with that, you are not done. You are recalibrating your exam taking skills. And if you do this properly, next time you won't be hoping to pass. You rather go in to execute and finish the exam. So if this video helped you, why not share it with a friend? Click on the like and subscribe button and drop us a comment so that we'll know how this video has helped you. See you in the next video.